All right, good morning, everyone. Can you hear me okay? Wonderful. My name is Emily Paulsen. I'm the Housing Program Manager for Anthem, Nevada Medicaid, and I'm really excited to be moderating today's panel. To me, housing is a human right. I believe everyone deserves a safe, dignified place to live. I also believe that housing is the foundation to good health, and I'm so proud to be working for a company that is committed to improving the lives and health of our members and investing in housing to do that for our members who are experiencing homelessness. I also believe that housing is transformative, and the first 7 years of my social work career were spent working in supportive housing. So I know firsthand that supportive housing works and supportive housing saves lives. So we're really excited today to be talking more about supportive housing. Today's session will showcase direct service providers who are providing services in housing in Nevada to learn about their experiences, strategize, and discuss how Nevada can scale best practices in supportive housing, especially as we began to discuss yesterday in yesterday's afternoon session on supportive housing. So I'm going to ask each of our speakers, we have 2 speakers joining us virtually today, and I'll just ask you to first introduce yourself and how your organization is involved in providing services in housing. And we'll start with you, Ariana.
Good morning, everybody. Hi, my name is Ariana Saunders. I am a senior program manager with CSH and part of the Southwest team. So Nevada is covered, and I'm a local resident here with Nevada. I've done supportive housing directly in my past, but in Nevada and in other states. But what I'm doing now for CSH directly, what we do is actually train and do technical assistance for folks that are implementing supportive housing. So we do a lot of training for direct service providers on how to do some of the best practices that we discussed yesterday, and especially around some of those best practice approaches such as motivational interviewing, assertive communication, de-escalation, all of that fun stuff. So happy to be here.
So my name is Reedy. I'm the executive director of NAMI Nevada. That's the National Alliance on Mental Illness here in Nevada. And I'm really here to try to give you a reason to invest in extremely low income housing and make that pencil out. So I'm here representing those people who live with a mental health condition. We advocate, we educate, and we support individuals who live with a mental health condition and the families that love them. Housing is the #1 call to our warm lines, to our helplines, to our office lines, and it's the one support that we're unable to even navigate them to. Up north, I call it the Tesla effect, because even if you're an average family, it's hard to find housing. And then if you're an average family that's looking for a rental and you have a pet, it's even harder. Now, when you're on limited income, whether it's services, disability services or whatever, and you have a support animal, you're homeless. Homelessness is not a choice among the universe of people I work with. That is why NAMI is sitting here, what the F, at a housing conference to try to get people to invest in extremely low income housing. Most of the people who work within NAMI Nevada, or NAMI in general, because it's a national group as well, have a lived experience, which means they're either living with a mental health condition or they're taking care of someone who's living with a mental health condition. And after I went through my professional life, basically dealing with what you guys are dealing with now, I come from a finance background, government finance background, worked for the state treasurer's office, issued bonds, did the finances for that. But after I retired from that, I said, I want to help people who have a mental health condition in this state. Nevada is number 51. We are dead last. Stigma kills. People are dying because they don't have housing. So my mother was mentally ill. We were in the military. We traveled all over in the Air Force. And I eventually ran away from that family in order to have a life. But the fact is, the only time my mother was stable in her life was when she's about my age now, in her 60s, and a little town in Ohio bought an old hotel. They turned that hotel into little studios. They put a fence around it, not to keep them in, but to keep other people out and keep them safe, because someone with a mental health condition typically is a victim of a crime and not the perpetrator. That is, they mandated meds, which is a whole nother issue, but it was the only time in her entire life that she was stable. The really frustrating part of this for me, coming from finance, is when you provide that help early on, services early on, wraparound services, first episode psychosis, all the work, all the science that happened over time. When you do that early, you save tax dollars. I mean, not just a little, you save tax dollars. And right now we have an economy that's going from a retail economy into an online economy. I don't know about you, but I rarely walk into a retail outlet anymore. And we have all these empty buildings. We need supportive housing in this state, not only in our urban, the Reno and Las Vegas areas, but especially in our rural areas. We don't have doctors, we don't have nurses, we don't have services, and things are changing. The last legislative session, great things happen, things are moving forward. And I, after being here for 30 years, have hope that there's some changes here. But the key, the housing is, the whole housing is the basis from which everyone thrives, no matter what your definition of thriving is. And we can make the numbers pencil. And we can save lives and save taxes in the long run. Thank you.
Thank you, Robin. We're so grateful for your advocacy and your work at NAMI. And we'd like to hear next from Teresa from Clark County Social Services about the work you're doing in supportive housing.
My name is Teresa. Can you hear me now?
A little closer to the mic, please.
Can you hear me now? This one's the mic on? Yeah, the mic's on. Is it? Can you hear me? Oh,
Yeah.
there. We have sound. Good morning. My name is Teresa Etcheberry and I work for Clark County Social Service. My job currently is overseeing a permanent supportive housing program for people that are chronically homeless and people that are literally homeless. My previous jobs for many, many years ago is working with people from all walks of life, people that needed services because they had some physical disability and they needed low income, stable, safe housing. I've worked with people that are mentally ill currently and in the past that need stable, safe housing. And I've worked with people that are just for losing their rent because they can't afford their rent anymore. They have minimum wage jobs. I've worked with people that have to work 2 jobs just to afford a 1-bedroom apartment. Some of them were single parents. Some of them were helping their elderly parents. And throughout my career, housing has been the main theme of how to keep people stably housed, how to keep people safe. and also how to keep people from utilizing higher levels of service. There's a lot of people that for lack of resources end up either in the hospital, they either end up on the street, or they end up in jail. And so in order for all of this to be prevented, to sort of divert, is that we really do need affordable housing and affordable housing with supportive services. I'm seeing it work for many, many years. I know that people that can have services while in affordable housing can really make a go of it, can maintain their stable housing, and also in cases increase their livelihood if they're able to work, but also be able to take care of some of their own needs, their behavioral health needs, be able to take care of their physical health needs. So I'm thankful for being here as part of the panel. And I'm thankful for all of you attending and listening to everyone here at the conference really advocate and really stress the need for affordable housing. Thank you.
Good morning. My name's Kelly Robson. I am the Chief Social Services Officer for Help Us Southern Nevada. We are a nonprofit who's been in the community for about 52 years. We have been providing permanent supportive housing for since about 2005. I am fortunate to be over all of our permanent supportive housing programs, but also over all of our social service programs, including rapid rehousing, transitional housing, emergency shelter, non-congregate shelter. All housing works. Today alone, 955 program beds, clients woke up in our program beds. So
Yeah, that
thank
deserves a
you.
round of applause.
That's a lot, but it doesn't compare to last week when we pulled the queue. When I pulled the queue for a different presentation, 3,300 clients are on our community queue waiting for housing. So I think that puts it a little more in perspective that we need to do better as a community. We know that permanent supportive housing works, but we know that we have a lot of people out there waiting to be housed, and we have to do better. We know that the support services align with affordable housing. We know that intensive case management works. We know that there's a lot of successes. We know that the model of PSH combined with support services works. We know that it works for our chronically homeless. We know that it works for our medically fragile. We know that it works for all of our populations. We just need to scale up. We need to be more creative. We need to think outside the box, and we need to just, as a community, put more in place, be more creative, and we just need to, as Nike says, just do it, because it does work. And our homeless, our medically fragile, our soon to be at-risk population, our families, our young adults, our seniors, everybody deserves to be in a house, and we can do it if we all come together. So I really look forward to hearing all of our creative ideas today from this panel, and look forward to the rest of the conference and creating change. Thank you.
Great. Thank you, Kelly. Next, we'll go to our two additional panel members who are joining us virtually today. And Julianna from Volunteers of America, Northern Nevada and Northern California. If you could introduce yourself, please.
Hey there, my name is Julianna Glock, and I work for Volunteers of America, Northern Nevada and Northern California chapter. I've worked here for about 15 years, and I also have worked with a variety of different populations. I currently am the Operations and Compliance Director, and I oversee our shelter programs here, as well as our Restart program. We offer some of the programs and services that we offer is we do street outreach where we go out, we engage with people, and we really try to encourage them to come in and seek the services that they need to start moving towards housing stability. We just opened a very large shelter that has 604 beds for people. We have a bridge housing program where individuals who have been accepted into maybe a permanent supportive housing program or a rapid rehousing program, we have a bridge housing project where they can go and stay in that location while they're literally looking for housing out in the community, because that often up here in Reno can take a very long time. We have rapid rehousing and we have a permanent supportive housing project. So it is my pleasure to be here. I also am looking forward to having some great conversations and putting our heads together and brainstorming some ideas. So thank you.
Thank you. And next we'll hear from you, Kirsten. Thank you for joining us.
Good morning. Hope you can hear me okay. I'm Kirsten Coulumbe, and I'm with the Division of Healthcare Financing and Policy, but that's a really long name and we're just really known as Medicaid. And, we're excited to be here today to be, part of this panel. Really for us, traditionally, at least from the federal perspective that we got authority, for services, it's always been that traditional like healthcare services. But in the recent years, there has been a specific recognition to try to incorporate into the Medicaid services, those more social determinants of health opportunities. And, housing is healthcare, certainly. And so we have been working over the longer than, I can imagine, but working closely with our county partners, as well as the continuums of care, to try to figure out how we can create some tenancy sustaining and pre-tenancy services. So, Medicaid we can't pay for room and board, so we can't pay for housing, but thankfully there, is a lot of opportunities I think that already exist for that. And what we're trying to work on is how Medicaid can integrate into the existing structure that is already set up in terms of the coordinated entry that happens throughout the state. We don't want to try to create a different process for these services that we're going to work on, and unfortunately, though, we can be bureaucratic, and so there's just a couple of challenges that we're working through. But certainly, it's a priority for us to try to set up these tenancy support services so that the community partners that are doing this work can then have a different avenue stream to reimburse for those services in terms of trying to secure the housing, and then the wrap services when someone is housed, how they can be successful in staying housed. And so then that, if we can create this sort of Medicaid billable model for that, then that would, hopefully alleviate perhaps some of the current strain that might be on our community partners, and quicken the housing, process for individuals, as well as create maybe new opportunities. Certainly thinking outside the box is, always great. And so that's really what the state is working on, is trying to create that model for pre-tenancy and then tenancy sustaining, and grateful to be here because we will, always are welcome to have providers, community providers join the Medicaid provider pool. And we do hear the feedback that can be a little difficult, and certainly because these potential community providers that might, become Medicaid providers might be new to us, they don't provide necessarily medical care. We are working closely to try to set up a structure to be able to be helpful to the potential providers. And so appreciate the opportunity to be able to explain more about that a little bit later when appropriate. So thank you for having me.
Great, thank you. Kelly and Kirsten, you both mentioned coordinated entry and the community queue. And for those who are listening in and who are in the room who might be unfamiliar with those terms, can you just give a really brief explanation of what that is and what information as a community and communities across the state, what we can pull from our community queue data? And what does it tell us today about the need for supportive housing?
I'm
So
not sure if Kristen wants to, or if she wants me to.
Kelly, yeah, if you would, if you
Okay.
wouldn't mind at least answering that first part about what coordinated entry is in our community queue.
Sure. So in order to receive HUD funding about, I think, 4 years now, 4 years ago, HUD mandated that we have one assessment for all homeless individuals to use so that it was a coordinated assessment. And then we, instead of using what we were using in Southern Nevada, all providers, as clients walked into our door, it was basically a first come, first serve. So at this point in time, we went to one housing assessment that all homeless got, and it was the same assessment. And then it was one community queue where instead of a first come, first serve, it was HUD was housing by the most vulnerable. So depending on that assessment, and we started using the VI SPDAT. We piloted it for about a year, and we realized that the VI SPDAT did not work for Southern Nevada. It just didn't address our community's homelessness. So after numerous hours in a room together, our coordinated entry systems work group realized that we were changing questions, we were adding additional questions, and we had created what's called the community housing assessment tool. So we use what's called a chat. We use an F chat for the families, and we use the youth TASPDAT, the next step tool for our youth. So no matter what coordinated assessment site you go to, the coordinated entry site, and there's numerous locations around Southern Nevada, you get the same assessment tool, and you're assessed as if you're homeless, you get that assessment tool given to you. Then you go into what's called a virtual queue, and you're placed in that queue by your assessment score. And then when a vacancy comes up, any provider who has a vacancy, they email what's called the community matchers. And the matchers will, depending on the eligibility for that program vacancy, they will email that provider the highest person. If it's a youth, they'll sort the community queue by the highest score, whoever meets that bed in eligibility, and they'll email the provider that participant from the HMIS. They'll send that referral through of who gets that bed. So now it's all based on vulnerability and whoever's the most vulnerable for that bed.
Great, thank you for that. We have a question coming in through our online audience. I'll take that now.
All right. From Donna, isn't there a new Medicaid waiver for some types of housing as health service in Nevada after the last legislative session? Is it the tenancy and pre-tenancy services you're talking about? And I think this was going back to a couple discussion points back. Is it the tenancy and pre-tenancy services you're talking about, or more? That's it.
Right. So let's talk now a little bit more about that waiver. What some of us may have come to know as the 1959 waiver. Those of you in the room who followed that during the legislative session. I'm going to invite you, Ariana, to talk on this first, because Corporation for Supportive Housing has been doing a lot of work on this in our state. So, what is the potential impact in our state of these tenancy supports? Why is this so important?
Thank you, Emily. And thank you, Donna, for that question, because I'm very passionate about this. We've seen it really be successful in several states. Currently, I'm working with Washington State and helping them provide technical assistance to providers who are implementing it. And I think what's key that Kirsten alluded to is it really does give providers such as Kelly and, well, not the county, but Kelly and Teresa, who are doing this permanent supportive housing work, the ability to expand and really weave in additional funding to provide those services to those that are most in need and that need that supportive housing structure. What we do know is that, you know, a lot of the funding that comes into Nevada does come from HUD, and being able to get Medicaid to provide that services. So Kelly and Teresa can have their staff supported through that revenue and through that reimbursement model. It gives them the ability to use HUD funding in other ways that can also support this programs towards rental assistance, towards other things. As Kirsten said, Medicaid can't pay for that, but what they can do is reimburse providers for providing those core key services, that intensive case management, that wraparound services, and helping somebody do whatever's necessary to stay in their housing. And so Nevada is working on that. And I know I'm not as much of an expert as Kirsten is, so I won't go into the details of what it looks like in Nevada. I'll let her do that. But I just think it really is a great opportunity, and we're really excited is doing that because we've seen real success in folks being able to expand their housing programs, serve more individuals, because they're able to, you know, narrow down what's on the housing queue and provide more services for folks who are really in desperate need of that support, and really a safe place where they can focus on their mental illness, on their medical fragility or their chronic health conditions.
Yeah, would anyone else like to speak on that?
So I just want to emphasize again, it's really freeing not to have to deal with all the rules and everything, that it makes you very free to say things.
And Robin, we just want to make sure you speak into the microphone so the online.
So shouldn't any of you here, if you didn't have a home to go to right now, today, and I'm assuming you, so that's an assumption right there, but what would you be worrying about? Would you be worrying about the meds you need to get? Would you be worrying about anything else but having a safe place to be right now? And so I just want to make sure everyone understands that housing is a key part of getting to recovery, no matter what disability you have, whether it's a mental health issue. So we at NAMI, we're advocating for supportive housing for extremely low income for anyone that has a disability, not just mental health. It is just that important because it's been proven, the wraparound services, making sure you're looking at work, making sure you're looking at schooling, making sure you're looking at everything is what works to get these people in recovery. And I understand the Medicaid rules and that they can't do certain things. And I work to advocate on the exemptions that are going through so that things, but put it in your own frame of thinking. The only thing you'd be thinking about if you didn't have a home is where you'd be safe tonight. And that's the only way we're going to get anyone into recovery, is by understanding that thought. And we have to change the rules. We have to change what Medicaid pays for and what it doesn't in order to get them in recovery and then save money.
Kirsten, did you want to add anything to this discussion on these sports?
Yeah, so thank you to Kelly for that detailed explanation, because I certainly couldn't have done that. But I think it just speaks to kind of the reasons why we are trying to integrate the new services. It is to answer the individual's question, it is from the actually the 19 session, so not recently, but it's taken us a while because we don't want to add to the burden of what the process kind of already exists. And so we certainly will have to have an assessment tool for the Medicaid services for tendency supports. And so that's where we're trying to figure out how we can not necessarily duplicate or add on to that really specific coordinated entry process. And, you know, Robin is 100% correct. The services that I'm working on are related to supporting the housing component, but, you know, certainly there's also those, once someone is stable and can be housed, and supporting them and all of their other medical services, which, you know, includes any type of behavioral health and mental health services. So that's really our goal, is to kind of add this to the complement of services that Medicaid does offer. Thank you.
Great, thank you. So back to the community queue. We know there are thousands, is that correct? Thousands of people who are waiting for supportive housing across our state right now. And we've been operating, you know, from a scarcity mindset for many years, right? If you all had a magic wand, what do you want to see happen now, especially with these monumental historic investments that we've heard throughout the conference? We know some of these dollars are going to be prioritized for supportive housing. What do you want to see happen with those dollars to scale this important intervention? Go ahead, Robin. Yeah, you're ready. Let's hear it.
I would like to see permanent supportive housing in every county in this state. 17 counties. They need to have at least one facility for supportive housing. Have that set up, whether it's a new building or whether it's an old building that's renovated, and that on the bottom floor, you have people renting space to provide services, whether it's the Medicaid, whether it's whatever. So the bottom floor is a central location that people can go to, and then there's housing in the rest of it. Have that paid for by the tremendous influx of money that we're getting, that big bulk of money coming in, so that it gets paid for, and help the operating costs by that rental of the people renting at the bottom, providing NAMI could rent a space in the bottom, and have that going forward, and have it again, not only just for behavioral health services, but just basically disability services, people who are not going to be able to support themselves. And there's a huge group out there that can't. And I say that because I didn't believe it for many years of my life. I didn't believe it was like people can pull themselves up by their bootstraps and people can do this. And yet when I retired from the state, and I went to work at FISH, Friends in Service Helping in Carson City, and they have a homeless shelter and they have a food bank. And I had to get a newsletter out, and they used the volunteers and clients to do this. And people were frozen in their inability to just put one piece of paper over another. Truly frozen. They were just not capable. They were so afraid of making a mistake. And it dawned on me that the world I had lived in for so many years was not the world everyone else is living in. There is a group, a segment of our society that needs help. And it doesn't mean they're less than. It just means they're not going to be doing things at the same pace perhaps I would do something at. And they can have great lives if they have a stable food source and housing. So I would like to see that. And in the process of all that, you can have a community center type thing where you also have like Alzheimer's care, where someone could bring someone who is living with dementia or Alzheimer's during the day, and the family can keep working. There is a way of mixing all these problems and all these generations and doing it in every county and make it pencil so that people can make money in the building and the processing of it, and then other people can thrive in their lives and live in recovery.
So I think I'd like to see one more community buy-in for affordable housing, and more housing where the rent equals a client's income. And that, I guess I mean by, for us who are doing this work every day. And we work with clients who we know that they're on Social Security disability. I believe it's now $794. I know that that huge 5% increase is coming, right? But when we know that FMR right now is $1,005 for a 1-bedroom, and you do the math of $794 and $1,005, they're never going to be able to become self-sufficient. So something's got to change. So we need more affordable housing that somebody who is on disability is going to be able to afford without a subsidy. So something like we need more community buy-in for those citizens of our community, right? Not even just, bless you, not even just those homeless people, but our community members who, because they're not all just homeless who are facing this, people who are becoming at risk of becoming homeless. But we need more low-income housing where rents equal people's income so they can live. So we need more buy-in. I mean, if we could just wave that wand and say, poof, we have all this money and all these rentals that now are affordable, and people could just say, oh, I'm going to put my application in here, here, and here. And we take away all of these. We have people who are willing to give people second chances. And so if you have a background, we're going to give you a second chance. We have where your credit may not matter because you have a second chance. So just, I would do a lot of things with the magic wand, but I don't want to take up all the time.
Teresa?
No, we had a pre-meeting about this, and I had a magic wand. I had to be scaled back. So here's my scaling back with my magic wand. There is a report out, the 2021 report that comes from the National Low Income Housing Coalition, and it's called Out of Reach. And they estimate that a full-time worker must earn at least $20.40 an hour to rent a modest 1-bedroom apartment, or $24.90 per hour to rent a modest 2-bedroom apartment. When you look at that and you look at what people make, you know, as far as low wage earners, they're either going to have to find roommates, or they're going to live in places that may not be the most safe for them. And especially here in Las Vegas and the greater Clark County, is that our transportation service is not the best. You have people that will have to travel just one way to get to their job by bus. And so depending on where they live, it could be something that they can't do. So the magic wand really is what I think both of the people that are sitting beside me are saying, is that it really isn't about people that have a disability, have a behavioral health issue. It really is about many, many people that are not going to be high wage earners, but they are working and they need a place to stay. They need a place to live that's safe, that can accommodate them. They need a place that will be close enough to their work, because some people may never be able to afford a car, so that they need someplace, they need something that's going to be close to transportation. I live in the northwest area of Las Vegas, and I decided, because I came from working and living in Washington State and also Portland, and both of those places I was able to use public transportation. I had a car, but I chose to do public transportation because it was just economical for me. I didn't have to pay for parking. I didn't have to pay for a lot of maintenance or gas for my car. So I took public transportation. And based on where I lived and where I worked, my public transportation, it took me maybe 30 minutes or 45 minutes, either by bus or from train. So I decided that where I live and where I work, I thought I'd take the bus to work one day. So I mapped it all out and everything. So I went and drove my car to where the bus station is. And I left my house at 6 o'clock in the morning to get to my job at 8 o'clock in the morning. It took from 6:30 until 7:45 on a bus from my house in Northwest to downtown, pretty much downtown Las Vegas, to get to work. And I thought that that was ridiculous, absolutely ridiculous. Now, did I read while I was there? Sure, I read. Did I interact with some folks that I would probably never, ever see in my lifetime? Yes, I did. But I really didn't want to get up that early in the morning to get myself to work, to get someplace at 6, to get on the bus at 6:30 and try to get to work by 8 o'clock. And so many people in the Valley are facing that. And so it really is imperative to think about location where affordable housing is built, so that there's where people are working, where the transportation is, that people can get to places. I know that Kelly experiences this with clients in our housing programs. Our case managers are often transporting clients to just medical appointments because it would take them 2 hours from where they're living to get to their provider. So, and if we are working and really encouraging clients to, the minute the client says, I think I need help, we're on that. And we try our best to get them to the help that they need. But we also want to make sure that we are helping them be independent, but it's really hard when they have to travel 2 hours to just get to an hour appointment. So my wish list is not just affordable housing, but affordable housing to where, and I don't know the building world, I don't know how you all live and exist, so this is my ignorance. But if you can work with public transportation while you are working with building affordable housing, that would be a big plus for a lot of low income folks that want to be able to get to their job in a timely fashion without having to get up at 3 o'clock in the morning to get to someplace, 3 hours later, and also to their medical appointments as well. So thank you.
Thank you. Juliana, do you have a magic wand? What do you want to see happen?
So in addition to what the other panelists have said, I agree with all of that. For Northern Nevada, I think having one building, I think that would be amazing. Like we currently, our permanent supportive housing projects that we currently offer are scattered site throughout the community. I think having one place where we could provide the supportive services to help people maintain their housing and work towards their goals to become self-sufficient would reduce the time of travel for the case managers. It would help with the transportation barriers that everybody was kind of addressing. I think also having like partnership with the builders or the landlords would be amazing. Where we're in there and we're helping the landlords and the builders to mitigate when issues do arise with the tenants. And we're right there on site at the location. I think that would be really helpful as well. That would probably be my magic wand right there, is to have more partnerships with the builders and the landlords because I really think it takes a whole community to help solve these issues, and it can't be left in the hands of just one type of provider. So I think that would be my magic wand wish.
So great. So we've heard a lot about the need to build more units that are specifically for permanent supportive housing. We know that's going to take a couple of years once those plans are approved for the actual construction to happen. So what do you need as service providers right now, from private partnerships, from landlords? What do you need right now in the interim to scale up supportive housing?
I think this, Juliana, I think the first thing that we would need or to scale up through those partnerships would possibly be more I'm trying to think, like, what do we need? I'm sorry, what was the question again? I lost what I was gonna say.
So we're looking forward to more units being built.
Right.
While that process is happening, what do you need now from private partnerships and particularly maybe from our landlord community, but other private entities or public partnerships? What do you need to scale up supportive housing in the interim?
So I think that my first thought would be so for the landlords and the partnerships, those to be willing to rent to people who are below 30% of the median income, to be willing to rent to people that maybe have zero income, to have the mental health disabilities as well as physical disabilities. I think just the willingness to rent to this population. What we see a lot here in Reno, I know earlier in the conversation, somebody had mentioned the Tesla effect, and I think that that's absolutely very true and real. We're seeing people and like housing providers that used to rent to our population, they are no longer renting to this population. And so those who have zero income to maybe 30% of the AMI, they really have nowhere, very limited places that we are able to rent from. So I think immediately, maybe being willing to rent to this population and to those with the zero to very low income.
Kelly, you want to answer next and then we'll come to you, Robin.
So I agree. I think there's a few things. I think one, landlord engagement. And I'm looking into the audience, looking at Linda Godoy from the landlord engagement team from Clark County, and she's shaking her head. So we definitely need the landlord engagement. There's a lot of landlords that we used to work with, and because the market is so tight here, they don't need us anymore. And they're able to raise their rents almost double and fill their units. So what's the incentive at this point for them to work with our population at this point in time? So we need more community buy-in from our landlords. We need more, obviously money is a huge one in order to scale up more and to do more. Right now, we need money and we need staff. I'm not sure if everybody is having the issues of hiring people right now, but hiring is not an easy job right now. And it is getting a little easier now that some of the unemployment went away. And I hate to say that, but hiring staff is slowly becoming easier, but it's not easy. So we definitely need staff to fill open positions. And then we need just more housing stock. Kirsten Cooper talked about Operation Home and how we've housed 61, I think Michelle said. I think there's over 100 though right now waiting to go into units. So it's not that we've only housed 61. It's that in our non-congregate shelter at Rita Suites right now, I think there's over like 100 who are matched to Operation Home providers. There's just not the units to put them into. So I think we've got almost over 100 people right now matched to programs that if we could find the units, it's actually, Linda's telling me 200. So we have 200 people. Okay, 273 people right now ready to go into housing if we had the housing units available. So it's the housing stock that we need. So we need landlords, and I think that's the biggest thing. So we need people to just give us a chance to prove that that we can work with them. And there's a lot of incentives that come with working with a provider. There's, I'm sure that a lot of these landlords and a lot of these apartment complexes have issues with tenants that they're already dealing with. And so a lot of times working with a nonprofit partner comes a 24-hour number that if you're having an issue with one of your tenants, you can call and we'll respond. So we just need people to give us an opportunity to show the benefits of working with a nonprofit partner. So we need that landlord engagement.
Tagging on to that, I would like to see, because it is such a long drawn out process, is a partnership commitment, whether it's on paper or in theory, that people who have land or people who have buildings and the city government and the state government and the federal government, a commitment to a pilot program of doing a building that we can go forward with to prove that it can work. We're talking really very much about the urban areas right now, Las Vegas and Reno, but we have 15 other counties out there. And, should people have to move to the urban areas to get services? Because there's just zero there when they're already comfortable, whether it's Story or Humboldt or, and again, I know that's really long range, but, get together with Catholic Charities and NAMI and whatever other groups, along with people who are willing to invest in the funding of these to make these work. I think we need that, and not just to build, but to renovate buildings that are already there. We have a Kmart in Carson that has been empty for 10 years. Do something with that piece of property. Talk about transportation in the urban areas, zero in the rural. You're in your home and you're isolated and you're not getting anywhere. And if you're going for mental health services from a rural community, you're doing it in the back of a patrol car.
All right, great. So we're going to turn it over for questions now. I know we have at least one from our virtual audience.
I would like to add
absolutely. Go
something.
ahead, Teresa.
So I would like to add to what Kelly was saying, is that all of our housing providers in our area, the bad thing and the good thing is that, oh, sorry, Linda, can you hear me? Okay. So to add on to what Kelly was saying is, it's good and bad, but all of the housing providers in our area, we are in competition for housing. Seriously, the housing is such that we are all in competition. And, it's sort of this, this running joke with our case managers to say, even our case managers within our own programs sometimes are saying, no, I called that apartment first. I need my client to come out of bridge housing. I called that first. And so that's really, it's a reality for us. And so, however you want to think about it, I have a success. One of the success stories is we had a gentleman that found himself homeless he lost his job. He tried to get another job and he couldn't do that. And he had a lot of health problems, and he came into our program. And through our services, we got him, he got healthy and he got onto Social Security. And of course, Social Security is not the be all end all of one's income, because you only get like a little COLA every year. And that is your mainstay for your income to pay your rent and utilities and food. I had met someone that is a property manager for a big apartment complex they are like the, elite kind of property managers, and they had all of these beautiful apartments. And so I was talking to her about our issue, and she says, well, if this person is really stable, and I don't know how this works. So I don't know if you all get a tax write-off to have some people that are low income in your apartment places. But apparently she says, if this person is stable and he's ready to move on from you, we would be willing to rent to him and we won't raise his rent. Now, that was just one person. And that gentleman was very grateful, and he broke down and cried This apartment's for me. It's kind of fancy. It's got granite countertops. And I said, yes, it's for you. And so I check in with him every once in a while. He's still there. He's still enjoying his apartment. He's working well, and he's made a few friends along the way in that apartment complex. But that story is rare, and I need to see it expand. That's, if I had, going back to the question of the magic wand, I need that kind of thing to expand. And I think all of us in the housing industry that provide supportive services would really like to see that.
Thank you, Teresa. Do we have a question from our virtual audience? And I think someone's going to need to run the mic over.
Thank you. Okay. Two, actually. So I'll start with one. We can do it and then move on to the next. All right. Let me scroll up here. So this is a comment / kind of question, looking for some thoughts about this. On top of the low wage workers, how about the large number of fixed income retired older adults who have their Social Security, maybe some savings or pension? They need our attention and advocacy too. Rents are getting so high, they're at risk of losing their rented homes. It is a real housing crisis here in Northern Nevada. Comments?
I totally agree with that. I think that in addition to the rents getting too high, I think there have been several of the properties that were more low income that have actually been torn down, and now new buildings are being built where the rents are much higher. I saw a comment prior to this one where it talked about all of the apartment complexes that have been going up in sparks, and the rents are like extremely high. I don't know how anybody with, in the workforce would be able to afford the rent without having a roommate or something to that nature. So I totally agree that is a real high, it's a housing crisis, I think, across all of Nevada.
I just want to say one thing, and it kind of speaks to the previous question. I think to that one too is, and that's where there is opportunity to invest in services now and invest in the continuum of care that folks need in terms of ensuring folks can stay housed. And that comes through those services to support them, as well as, rental subsidies. But it's also, that's something that we can do now and prepare. And so we don't have, more people experiencing homelessness. We do also need to focus on those that are unstably housed. Sure, thank you. So there's a lot that's coming into the communities in terms from the federal government, in terms of vouchers that can be utilized that folks can take advantage of that will provide rental subsidies or at least help pay a portion of their rent. There's also opportunities for communities to develop flexible funding pools where they can utilize some of that funding to give shallow rent subsidies, meaning somebody who is on a fixed income and is living in an apartment that say is $900 to make it affordable so it's less than 30% of their income, giving them a portion of that to pay for that rent. And I think that's where we also have to take into consideration is there's ways where we can get innovative to make sure that we're serving the diversity of folks and the diversity of needs that are in the community. And a lot of that can be done now. And I also think to that effect too, is that we do know there's folks out there that have been stably housed that are experiencing these crises. And it's not just that they need those shallow rental subsidies, that there's an emotional and physical taxing that comes with that. And so being able to have more flexible funding, so there are services, or I'll just say ACT teams or things like that where folks can meet people where they are. They may not necessarily be in a supportive housing program, but there's flexibility in providing them services so they are stably housed and they don't necessarily need to stay in supportive housing forever. And to Teresa's point, creating that churn, because we do have a fixed set amount of supportive housing units in our community right now, and we're waiting for more to come online, there's folks that are stably housed that are okay, but they just need that rental subsidy or that shallow rental subsidy so they can maintain their unit and continue to thrive in the community, and maybe less intensive services. And so just recognizing that there's opportunity to provide, a variety of support for folks is really key.
Thank you. There is another question type thing going on here around asking if anyone in this audience or at the conference in general are from the apartment association or the landlord association to hear from. And if not in this room, maybe speaking to what that partnership can look like. We know the need. How does that kind of get advocated for and facilitated? Is there anyone in this room from apartment association landlord? Oh, thank you.
Sure. Those of you who know me know that I'm not from the apartment association, but I was looking for Susie. Susie was here. There's Susie. Hi, Susie. Yeah, so Susie is an active member of our landlord engagement team right now. And so I'm really glad that she's here so that she can speak to that. We have a landlord engagement team that works in Southern Nevada. Its sole purpose is to engage landlords. I am the supervisor of the LEAPS unit. Kelly was talking about that earlier. My name is Linda Godoy. For anyone, I just want to take a quick plug before Susie talks though. If you're a landlord in this room and you're interested in providing services to the folks that they're talking about, the people in supportive housing programs, I am your contact person. leaps@clarkcountynv.gov is my email. I will be here today if you see me and you want to participate in any of these programs and register as a landlord. It's very easy. We get your W-9, we get your ACH, and boom, you're a landlord with us. We do have a lot of benefits to working with our program. We can do double rent security deposits up front for folks that might be a risk to you. We have some sign-on bonuses for $500 a unit right now for one of our programs. We're trying to get it for all of them. Michelle, hint, hint. We also can do what's called risk mitigation, which means if you have damages to your unit after a tenant in our program uses that unit and you've used up your security deposits, we can assist you up to an additional $3,000 towards the cost of making that apartment whole. We also have case management support, as you've been hearing about for the last couple of days. We have case managers that work with the clients, but the LEAPS team works with the landlords. So we are your landlord support team. We are here to make sure that we have a good relationship with you and that we're doing everything we can to mediate any concerns that you might have. So yeah, let me know if you need me. leaps@clarkcountynv.gov. My name is Linda Godoy. And like I said, I'll be here. And this is Susie. And Susie is, I believe, the executive director of the Apartment Association here in Las Vegas.
Actually, we represent 67% of multifamily in the entire state of Nevada. So I have 163,000 units as members. And we committed actually in 2019, right before the pandemic, to be part of the solution. So we have been engaging with Linda Godoy, Christine Hess. Oh my gosh, I cannot tell you how excited I was to meet her when she joined Nevada Housing Coalition, because she, just like I am rainbows and butterflies, unicorns. And we truly are wanting to be part of the solution. We've been having many, many conversations. We've been providing data for the LEAPS team to be able to move forward with a well-rounded program that I think that we have finally reached. We invited them recently to our reverse trade show, where essentially it's our property management companies, it's 14 of them that sit at tables, and our supplier partners come around and have kind of a speed dating round with everyone, 10 minutes at a time. The LEAPS program was there and was actually able to capture 30 units approximately for future use. And the reason why I say future use is because, as we all know, vacancy right now is at 3.9%, which means we're at 6,800 units available in Clark County. Normally we have 11,000. A good chunk of the 6,800 units are new construction, so they're not necessarily available to those that would qualify for that 30%, even 50 or 60% income criteria. So another thing that we're working on, just so everybody knows, is source of income protections. Obviously, we're not a huge fan because of the potential issues that they may cause. However, we have stated and continue to state we don't have a problem with the voucher. The voucher to us as property managers is a paycheck stub. And that's how we look at it. So I have opened up conversations here locally, hopefully with, as the new executive director comes on board with the Housing Authority, to make the program a little easier for landlords to understand. So just really quickly, the voucher comes to a property manager. It's Greek to us. We know that the person qualifies. We know that they are a 2 or 4 person income household, or 2 or 4 person household, but we don't know how much the voucher is worth. So simple little fixes like adding a box to that and saying this voucher is worth this much, because I train my people to say that's a paycheck stub. It really, that's all it is. And if you can take that paycheck stub, use it for your income requirement, it's usually pretty easy to qualify people. Another concern that we have, which we will hopefully overcome, is there's free money sitting on the table and nobody's asking us why we're not taking it. You know, we're greedy landlords, which we're not, but that's the stigma that we've carried over generations. We don't have a monocle. We don't have a top hat. We are institutional clients. However, everybody has to understand that our institutional clients are tied to your pensions, or they're tied to teacher pensions. They're tied to insurance policies. It's kind of, we're in the world of hotels now. And if you can equate us to that, it makes it a little bit easier to understand what a landlord truly is. The days of mom and pops are gone. There are a lot out there, more so in Northern Nevada than there is anywhere else in the state, but those days have passed. And for me to be able to reach them is really, really hard. So again, source of income, don't have a problem with it. We look at it as a paycheck stub. The other issue that we're working on with the LEAPS team is housing barriers. We understand housing barriers are an issue. And we're polling nonprofits. If you are a nonprofit that has housing, hopefully Christine has sent that poll out to you. And we're working on getting a pilot program, hopefully, that resembles one out of Washington that has moved over now to Denver, which reduces the barriers that people that are within your programs experience when applying for housing. So lots of good things in the work. Again, the Apartment Association wants to be part of the solution. We have committed that as a board to become part of the solution, have those conversations. So I've had over the last 2 weeks, probably 10, maybe 12 meetings with different organizations, different municipalities. I'm so excited that the counties and the cities are all looking at the money that's coming in to use in a creative way. I know my nonprofit builders are, one of them that's in the room, are part of those conversations. I can tell you that we can probably develop a lot more 60% housing, but to get to that 30%, that really is the focus that needs to come from the municipalities and the government, because we can't make it pencil. We just can't. No matter how hard we try, it's impossible with the cost of goods, the cost of labor, and everything else is associated. We're also looking at permitting delays, planning delays, a lot of the things that add costs to development. But I do want to see, I just really, really want to focus on the fact that I am in the room. Christine and I probably speak more often than we need to, but we really want to keep each other in the loop. I applaud the Nevada Housing Coalition for what they've done, what they're bringing to the table, and the future that they're creating by all of these great ideas actually going into play and making it happen. So thank you all for all that you do for supportive housing and other housing needs that you provide, because it does take a village. And we've always said that, you know, our communities, it takes a village for them to run and operate, but it does also takes a village and a community to solve this problem that's not new to Nevada, but hopefully will be in our review here in the years to come.
Thank you, Susie. Thank you for your partnership. We just have a few minutes left, but I did want to invite questions from our live audience and/or suggestions, creative solutions that weren't discussed today. Hi, Vera, come to you. Getting my steps in.
Thank you. I just have a really quick question because I noticed that we talk around low income, low wages, Social Security as our target population. And then we even mention minimizing barriers. But I'd like to know how people that are formerly incarcerated fit into this. They're literally coming home into our community. They fit all these different target populations with low income, mental health issues. And then they have this thing that's on top of it, right? Which is criminal history. And when we talk about minimizing barriers with the legislative season just passing and they just kicking that under the rug with the limiting the landlords on being able to run background checks, what are we going to do about that? Like what is the solution, or does anyone in this in the room have a solution or want to partner? Because that's what I do. I work with people that are formerly incarcerated, and I have about 15 women ready to get an apartment, but they cannot because of their criminal history, because it's so recent, one, and then they fit the low wages. And we can fix the low wages by getting them additional employment. But where else do they go? So I'm just wondering if we're going to add formerly incarcerated to the population, the target population, and if we're going to add some solutions that really target them as well.
Thank you, Vera. Thank you for the work you're doing in the community. And that question, does anyone want to comment on that? Go ahead.
I just want to bring up the NAMI Nevada and the Northern Nevada affiliate. We actually have a peer support specialist that we use to interact with people who are going through the justice system, whether they're in a detention facility, going through the court system, things like that. And he tries to navigate housing and anything that individual needs. And we do want to expand that statewide. We also have programs where we go inside correctional facilities and we train people to put on support groups within the facility so that, again, and then as they get released, we try to do a warm handoff to one of our affiliates so that, again, someone can help navigate the area, the geographic area they're going. But it's a serious problem. Again, another invisible barrier that most people don't recognize. Even when I worked at Fish, when we have housing for people who are homeless, if depending on the crime, they couldn't come into our housing facilities because of insurance and everything like that. So we really all need to be much more aware. If we're committed to people coming out of corrections and getting their lives back on track, we have to allow for that. And the vast majority of people who are in corrections right now have an underlying mental health problem. That's one of the focuses we have, is decriminalizing mental health. But if we don't all accept that, it's just never going to change. But we are trying to build our resources to do that at NAMI.
Go ahead, Kelly.
So I would say this is something that we face on a regular basis, not just with people who are just recently coming out of prison, but with clients that are referred to us on an everyday basis because of their background, felons, sex offenders, just backgrounds in general. So the only way we've been able to work around it, and we're not always able to work around it, so it is a huge barrier that we face on a daily basis, is with relationships that we've built with certain landlords. And Stacy, one of our partners from Hope is shaking her head also. It's just a relationship building with your landlords who do not do background checks. And there's not a lot of them in our community, but it's basically that constant relationship building with certain landlords that you've worked with for numerous decades and years, who will allow you to place those clients in their properties with no questions asked. And we need more of those who are willing to take those risks with our clients. But that's really, we know this when we have clients that everybody else will refuse, that we have those landlords we can kind of take that It's like that last chance with, and we have to wait for vacancies in those units to place those clients at.
Yes, yes, you can. And then we'll wrap after this. And I was told to tell you, Vera, that a new working group has been established through the Southern Nevada Homelessness Continuum of Care to focus specifically on this. And we want to make sure you're invited to that.
Yes, absolutely. I think that what just stood out to me is that we go out and we try to establish these relationships, right? And we try and advocate on behalf of individuals. And what happens in our community is that there's a sense of segregation. So we end up with the individuals and landlords that will provide a second chance, putting our family members, which are the people that have come home, that are home, that their criminal history is under or over 7 years or even under 7 years. We put them into areas that are not conducive to them being rehabbed within our community. And then the cycle perpetuates. And it not only perpetuates with that person, but then with that family and their children. So when are we going to hold the landlords responsible? And I think that, like the work opportunity tax credit, if we could form something like that, where we would give landlords a credit for working with individuals like the people that I work with, my family members, then maybe we would be able to get a little further, because right now there's no limitation, there's no standard. And the people that aren't running background checks, all they're doing is gouging them for the rent. They don't fix anything. And then they're putting them in these areas where prostitution and drugs are running rampant. And then they're right in the same position as they started out right before they went to incarceration. So that's the kind of solution that I'm hoping for, something like a work opportunity tax credit. And I'd love to be on anyone's team that is working for something like that, because it will be beneficial to our entire community, our entire state, right? Our entire country, seeing as how we have the most incarcerated people in the world, right? Just saying.
Thank you, Vera. And I regret that this just came up at the end of our session today, because I think there's so much discussion that is needed here, and that this really does deserve more time and attention. So maybe we can suggest for our next housing conference to Christine that we have a panel, perhaps just on that, on addressing the housing needs of our community members who are reentering from jail or prison. But we have to wrap it up today because we're out of time. So I just want to thank our panel of speakers again, and everyone who joined us online and here today with your questions and feedback. And I think we have a quick break before our next session, or is it lunchtime? Lunchtime? Break. Okay. Great. Thank you.